Hi. So today it's Wednesday, our very own cognitive autism cognitive Wednesday. So today I will talk about meltdown, which is a very important and very stressful part of being an autism mom. And I personally have had my share of stories, okay? And I would like to start by saying something incongruent to the fact about meltdown. Okay, so let's start by talking about what specifically meltdown is. Okay, so meltdown, the regular children, they also have meltdown. Autism kids also have meltdown. So what is the difference between a regular kids having a meltdown and an autism kid having a meltdown? So for a regular kid, there can be plausible reason the child got hurt, not getting enough attention, or some other physical aspect, or maybe not getting their way. And it's easier to handle the regular kids meltdown than it is for the autism kids meltdown. And the fact that they cannot express themselves, and about two-thirds of them are nonverbal, so their factors are different, very different. And so, yeah, talking about autism meltdown, basically there are a few reasons why it happens, and I have got my trusty notes here so that I don't forget. I am a neurodiverse myself, so I do forget a lot. Let's get to it. So the first thing I wanted to say is the first reason why these kids have a different category of meltdown, or maybe more frequent meltdown. The first reason being is they're nonverbal, or they have severe to moderate to severe language and communication trouble that they are having. So can you imagine when you are trying to convey your message to someone and that other person isn't understanding? It will be frustrating to you, right? So it's frustrating to them also. Just trying to imagine yourself in their shoes, and I'm sure you will understand why they will be feeling that much of a stress, that much of like reason for them to be crying a lot more than the others. And the next problem is they are having difficulties in their body. Maybe they are feeling gassy, they're feeling discomfort, they are feeling sensory issues, like I can give my example. The reason why I understand my son and autism kids in general, because I am a neurodiverse myself and I have sensory issues. I still have sensory issues, and sensory issues can be so much different. Like now when I'm talking to you, I'm feeling like a little unease around my shoulders, and it's spiny, it's tingly. So now I am a 33-year-old adult, and I'm shooting this video, so I'm feeling a bit nervous. So, and I know why I'm feeling this and what I'm feeling, so I'm okay with it. But when I was younger, I would feel the urge to cry all the time. I would be pretty much crying kind. I would cry a lot. You can ask my husband, I still do a lot. Okay, so the fact that they feel discomfort, the fact that they feel sensory issues, sensitivity in their body or to the surrounding, loud noise, or gas troubles, constipation is another very, very hard point for them to handle. Because even if you have constipation, you know that you will feel tightness in the body, in the stomach or in the abdomen specifically. You will feel tightness, you will feel irritation, you will feel pain. So all those things also lead to frequent meltdown. And then they have other issues with the brain feeling foggy. Okay, the brain feeling foggy is a way, like when you wake up suddenly at night, sometimes you feel like you don't know where you are and you cannot articulate why you woke up or why you are feeling this way. So imagine them having this feeling very often throughout the day. Okay, so whenever they feel like this, obviously they're very young, they don't know, they don't understand themselves, they don't understand the world around themselves. So sudden shifts of those brain structures or brain signals will throw them off guard. They will feel totally out of their control. Okay, and the most specific reason why they have so much tantrum, so much why do I keep calling tantrum? I don't know. So much of meltdown is because they they kind of totally feel disconnected from the environment. The way that we feel comfortable, we are familiar in this environment, they don't feel that way. They feel like they are somewhere else. Oops, that's a small incident. So let's continue. Happens to newbies, right? Okay. So another point I wanted to discuss was their dopamine and cortisol levels. Okay, so the dopamine is a very important brain neurotransmitter and a hormone which helps the brain to regulate emotions. Okay, dopamine is that good feeling substance which when your brain gets the hit from it, you feel happy. Okay, every time there is a notification or someone liked your post or you get to eat a chocolate, you feel that hit of pleasure. It's dopamine. Okay, so typically our brain is supposed to produce a certain level of dopamine, and the children are supposed to produce their level of dopamine as well. But what happens is the autism kids have so different neurotransmitter levels, and they're so different biotransmitters and neurological substances in their body and system, is that the level of dopamine is mostly low than the regular kids or us in general. And the fact that the level of cortisol going up because of the child feeling unsafe, child feeling sad, sick, constipated, and all the issues that I have discussed so far. So what happens is that the brain was supposed to give them the dopamine, which would make them feel more in tune with themselves. So it's not being produced. The brain is not producing dopamine, and instead the body is producing cortisol, which makes you stress. So there is more stress, but less of what that will help the stress. Okay, so less of help, more of problem. That's another reason why they're feeling more prone to meltdowns. Okay, so far we have discussed why they are having meltdowns and the reasons why, what you can help them with. And now I would like to discuss how you can help the meltdowns being less. That didn't make proper sense. How you can help them have less meltdown, and if meltdown occurs, how you can help it more. Okay, so the first thing that you can do is whenever, let's say they are in a meltdown, okay, they started crying, they started just without any reason. You might feel like it's without any reason, but actually there is a reason. The first thing you have to do is, as I said before also in one of my other video, just go hug your child, get him or her out of the position that they are in, and then hug it out a bit. Like when you are hugging your child, his cortisol level will go down. Another hormone which we call oxytocin, the love hormone, which helps in the bonding and also reducing the cortisol level and also giving the dopamine high. Okay, so when you hug your child, you are lowering cortisol, you are increasing their dopamine, and that itself chemically will reduce the tantrum or meltdown. I don't know what happened to me today. We are talking about meltdown, but I keep talking about tantrum. Never mind. So Lots of hugs, lots of cuddles, soft voice, cooing, okay? And then another thing that you have to do, since you know I'm more holistic based, more diet and lifestyle based, the next important thing that you have to do, or you can do to help them, is give them good protein and good fats, okay? Good proteins being lean protein like turkey, or fatty portion of the beef, as well as chicken or pigeon or other games or other forms of poultry you can give them. So what does protein do is protein increases the production of dopamine, which is the feel good hormone, okay? So when you give them more protein, they will produce more dopamine, so they will have less tantrum, less meltdown, okay? And another thing is giving them good fat. So what are the good fats? Animal fats are good, not the monster that we are told. They're not. So animal fats, fats from flaxseed, hemp oil, cod liver oil, all those things are also very important and very essential. Egg yolk. And so what all these essential fatty acids does is it helps the brain produce more DHA, more dopamine, and all the neurotransmitters that's necessary for the brain to function properly and be in a lower state of anxiety, okay? And the third thing that you can do is be targeted to their digestion. Okay, when they are digesting their food properly, there will be less gas production, and then when there is less gas, there will be a general good feeling in the body. Okay, there will be less crankiness, less irritability. All right, and another thing you can do is give them massage their abdominal area before they sleep, or after they had their bath. Massage helps the blood circulation, and also it gives you the oxytocin boost due to the how to say it, touch. Okay, when we are touching another person, our child, what it helps is it increases the oxytocin level, which I have told just now decreases cortisol and increases the dopamine level. Okay, so yeah, with lots of cuddles, lots of good fat, and lots of good proteins, lots of understanding, massage, and the specific digestive system troubles going down, you will have the meltdown under control and very much easy to handle. At least it has been like that for us and also for all of my clients. So hope that helped, and I would really love to know if any of this information was new to you, or you can also share what you know about meltdowns and how you take care of your child. It would be really nice for every one of us to know about it. Okay, thank you very much. I will see you soon. Bye.